We are often told of the warning signs of depression, but does depression present the same way in those over the age of 65? Joining us now to help answer that, Dr. Robert Madan. He is Chief of Psychiatry at Baycrest Health Sciences, and Donald Burnett, who is a retired chartered accountant. And we're grateful to both of you for coming to our studios here in Leaside today, especially you, Donald. You came all the way from Kleinburg, which is a heck of a drive, so thanks so much for that. Robert Madan, let's start with this. Geriatric depression. What is it?
So depression is a medical illness. Sometimes people forget that. Sometimes people will think that depression is a personal weakness, but it's an illness no different than anything else, no different than pneumonia or stroke or heart disease. The brain is not immune and is vulnerable to malfunctioning like any other part of the body. And depression affects thoughts, people's thinking patterns, their mood, their feelings, and their actions, and very often will present with physical symptoms as well, like low energy, poor sleep. And people's thoughts tend to be very negative during this time.
Geriatric depression different from regular depression?
There's some evidence possibly that people with depression in later life present less with low mood or complain less of depressed mood and describe more anhedonia, which means a lack of pleasure, inability to have pleasure, lack of interest, and more difficulties with subjective complaints of memory loss or poor concentration. So there's some evidence for that, possibly less feelings of worthlessness, but that's a generalization. I think from person to person they may present somewhat differently, and there's not a very dramatic difference between the way people present, but the causes might be somewhat different.
Gotcha. I guess what I'm trying to figure out is if you suffered from depression earlier in life, are you just as likely to suffer from depression post-65? In other words, would it be unusual if you had a fairly carefree, optimistic outlook on life, suddenly in retirement, to have depression come on you?
It happens.
It does.
And there's two kinds of people that could present. There's those who've had depression at a younger age. They've had it in their 20s or 30s or 40s, and now they've had a recurrence for whatever reason, whatever situation. And there's a second group that developed depression for the first time ever, despite having gone through life and maybe dealt with divorce or bankruptcy or immigration, and then later in life developed depression for the first time in their 70s or 80s or even 90s. And with that group, we wonder more about biological factors, medical illnesses that could contribute, as well as the social context. So you're not protected just by not having had it before. You're not protected for developing it later in life after 65.
Gotcha. Okay. You were a chartered accountant for how long?
About 30 years, I think.
30 years,
yeah.
eh? Did you, was it in some respects, your life? Did you see your identity wrapped up in a lot of that?
Yeah, I'd say that's true. Yeah.
And so when you made the decision to retire, or I should say, was the decision made for you, or did you decide?
The decision was made for me.
Meaning?
Meaning that I was outsourced, there was a package, and I really wasn't ready to retire, and I hadn't really thought about it, and I think that was one of my triggers.
How old were you at the time when this happened?
About 58.
58.
Yeah.
So clearly well before you wanted to do it.
Yeah.
Had you had your druthers, you'd have been a CA for...
Well, maybe till now.
Till now.
Yeah,
How old are you now?
I'm 67.
Okay, so you easily would have wanted to have another 10 years in that. All right, so you now find yourself retired, quote unquote. What's the plan? Do you want to look for another job right away, or do you think, well, I'm sort of close to the age, so maybe this is it?
Well, when all this went down, I did all the right things. I, looked at other positions, and you chase after this job or that job, but eventually I just found myself getting to a point where I would just take jobs at minimum wage just to keep busy, so that I didn't feel useless. And gradually it just evolved into this thing where it was a very dark place.
Let me ask about that dark place, because did you understand the difference between I'm not doing what I want to be doing and I'm sad, from I think I may have a clinical depression here?
Well, that's a hard question. Basically, I think that I wasn't aware of just how things were going with me. It got to a point where the analogy I use is like walking through a tar pit, and it's just this deep, dark, oily goo. And every step you take, it seems like something's pulling you back. And it gets to a point where you just sort of give up and sort of fold in on yourself and hide. And but I didn't realize that at the time. It took my family to sort of say, there's something wrong with you, Don. Let's chase after that.
So who was it in your family who suggested you need to get some professional help?
My daughter and my wife. Yeah.
They both said it's time.
Yeah.
How did you react to that advice?
Again, I think I was not aware of the fog that I was in and what was happening. And I said, well, okay, fine. Keep peace in the family. Yeah, we'll do it. And that eventually led me to meeting Dr. Madan.
You sought him out?
I actually was over at Baycrest with another doctor, and my wife and daughter had thought that I had dementia or some form of that. And so we went through that whole process, and that physician said, no, that's not the problem. I want to see Dr. Madan. And the rest is history. I'm glad I did.
The rest is history, because when he presented himself to you for the first time, what did you see?
Saw a man with clinical depression, major depressive episode. It's not uncommon. This is not an uncommon story. A presentation of memory complaints, poor attention. These are some of the symptoms you could have with depression. So the neurologist picked that up very easily and said, this isn't Alzheimer's disease. This looks like a major depressive episode, which could really affect people's thinking. So when Don presented, he came with a story, a context of what happened, and all the symptoms of depression. So we made the diagnosis and discussed treatment.
Was there any question in your mind that his depression was brought on by the way his career ended?
It's partly when we consider why somebody would get ill, in medicine in general, but especially in psychiatry, we consider psychological factors, social factors, and biological factors, which usually converge. Some combination of them will converge to exceed a threshold beyond which someone would get sick. So, there's a context, obviously, having been downsized, I guess would be the word. That was a significant stressor. Don talks about, feeling useless just before. So it has a psychological impact. Then we have to start considering, but what else? I mean, why would this man develop depression at this stage in life, having never had it before? So we have to take into consideration possible medical causes. So Don already had some brain scans, blood work, there's some cardiac history.
Any hints there about?
And everything was fairly normal, so which is reassuring. You want to treat what's treatable if there's a medical cause, something that's reversible. And then it appeared very clear that he has a major depressive episode, and then that informed our treatment.
Let's talk about, do you mind talking about the treatment?
No.
What did he do for you?
A lot of one-on-one. Mostly it was, Don, you talk, and I'll listen. And it was reassuring. We worked very closely. He was kind. He was open. It was great to be able to talk to somebody who wasn't going to be judgmental. And after a while, we began to talk. He suggested some medications. We tried, this strength, that strength, this one, that one.
What did they do for you, if anything?
I think my understanding is, and you can correct me if I'm wrong, but it helps the body produce the chemicals that it needs to keep in balance. So as long as you're taking these medications, it just seems you're feeling quite fine. You're level. Are
you on anything right now?
Yes.
You have to take something every day?
Yes.
For the rest of your life, as far as you know?
That's my understanding.
That's your plan. I'm going to make an inference here, and if it's wrong, you tell me, but my hunch is most men from your generation think it's a sign of weakness to acknowledge that you have some kind of depression, whether it's related to the end of your career or whatever. Would that be part of the obstacle to seeking treatment? First of all, am I right? And if I am, is that part of the obstacle to seeking treatment?
Well, I can't talk for all men, but I can say for myself, yeah, you sort of feel, it's a sign of weakness. You don't want I didn't discuss this at all for a long time with my wife or my daughter, and it was them that brought it up. So you sort of feel that you don't want to, show this sign of weakness or a failure, and it's not. But at the time, I felt that way, but very quickly I found out differently.
How much is that generational sense of I have to be strong for everybody an obstacle to you getting to the finish line in what you do?
Well, it's definitely a cohort effect. Certainly, there's been discussion about roles and masculine roles in these generations, probably in our generation as well. But what's interesting is it's supported by the research. What Dawn says, there's some research that shows that men may actually experience the symptoms a little differently and may not realize that they're actually symptoms of depression, so may not report it. It won't bring them to the family doctor. And then when they present to the family doctor, they might have different symptoms than what's described clinically. So it takes obviously a skilled clinician to pick up on it. And then there's the potential biases of the family doctor, whoever the person presents to, and how they view that person and whether or not they're sick. So there's a potential difference in that. And what Don says, he presented with memory complaints, not with depressed mood. Had he known he had depression, he would have gone straight to a psychiatrist. But instead it was perceived and felt in a different way.
What couldn't you remember that you used to be able to remember?
Oh, I think a lot of it was just short-term, being extremely forgetful. It wasn't the case that I couldn't remember, way back or whatever, but just being terribly forgetful and unsure. So that when you forgot something, you weren't sure what it was you've even forgotten, but you knew something was missing.
My guess is you got up pretty much every day of your life and went to work.
Oh yeah.
And then comes the day where you get up and you really don't have to do anything.
Yeah.
You don't know what to do with yourself on those days. Did you have to figure that out?
To some extent, yes. I have a good part-time job that I go to, and it's probably the best job I've ever had in the world.
What is it?
I drive cars for a rental company. It's also the lowest paying job I've ever had in my life, but it's not the money. And I work with a crew of individuals, and we're all different, but we've become family.
Are you the oldest guy in the crew?
No. I'm one of the younger ones, actually. A fella had his birthday yesterday. He's 74.
Oh, okay.
We had another guy, and until he passed away, was around 90.
No kidding.
Yeah.
This, I guess, points to the need that people have to kind of feel needed, to belong to something. He found something. How key is that to recovery?
Oh, it's critical. We actually look at the literature, the research around retirement and depression. Most people who retire don't develop depression on a large scale. There's large studies with thousands of people. But in terms of what might prevent depression and what might be associated with depression, it looks like caregiving. Caregiving to a sick relative, looking after someone with dementia or Alzheimer's disease or someone that could increase the risk of depression. But volunteerism, so volunteer work, paid work, and informal helping, but not caregiving, seem to be somewhat protective. There's some research to show that. And looking after grandchildren seems to be equivocal, not necessarily associated with or without or depression or not with depression. So, but when we look at how people view themselves, there's a need to be productive, to feel like you belong. If you look at volunteer work, you're part of something, you're integrated with an organization of some sort, you're interacting with other people. So that's obviously very important. Dawn talks about feeling like family, but people need a role. And we look at interpersonal psychotherapy, which is the kind of therapy Dawn received when we were doing psychotherapy and medication management. We talk a lot about role transition. Went from one role to another role. And I often ask people in their 60s, 70s, 80s, even 90s, what would you like to do with your life? You're getting better now, so what do you want to do now? And people sit back in the chair and think about it. I haven't thought about it that way. So that's a critically important. When we think of someone's recovery, we look at the variables that got them sick and try and work on those. So if the context was retirement and feeling useless or like there's no role, then how are we going to fill that gap?
Let me ask you about gender, because I would assume that this is a phenomenon that overwhelmingly affects more men than women. Is that true?
Geriatric depression?
Yes.
No. It's actually, the research shows the rates are about 3 to 4%, slightly more for women than for men.
No kidding.
But that's probably because, again, of how people present. So it might be that less men actually present to the family doctors or to psychiatrists with depression. So when you count the numbers, it might be artificially low for men. And when you look at people who don't meet the criteria, the clinical criteria fully, subthreshold or subsyndromal depression, the rates increase dramatically. So we're looking at, in the community, about 10%, family doctors' offices about 25%, medical surgical units, 30% of depression, long-term care, 45%, up to that in some research studies for people who present with clinically significant symptoms of depression that don't quite meet the criteria that still have bad outcomes and could convert to depression. So gender, it's probably about equal.
Interesting. In our last minute here, how you doing?
I'm doing fine. Basically, I tell people life is good. Is it perfect? No. Do I have the odd bad day? Yeah, on occasion.
Do you have those days still where you feel like you're in the tar?
No, not that bad.
It's not that bad anymore.
Oh, no. It's just a case of, I think if I were to continue on with whatever it was that I was doing at that point in time, it might drive me back. But I've learned to manage it now, and I know that, okay, stop, just take a deep breath and carry on. And it goes away, you know. I think we all have those days, you know.
We're really glad, number one, that you're feeling so good. That's great. And we're really grateful to both of you for coming in tonight and sharing your views on this. Thanks so much.
Thank
No
you.
problem.
Thanks for having us.